Hi, good afternoon. I want to take a few minutes to speak to everybody about the new electronic health record system that we're going to be implementing here at the facility over the next few months. Of course, change is always a bit scary, and especially when you're going from something you're used to, such as paper, to all electronics, it can be a little intimidating. However, it will also streamline our process with dealing with our patients. I think it will increase our efficiency in the way we handle our patients and their health care. I think that you will find that things move through much smoother and much faster with the patient flow through the facility. Some of the benefits of having this is going to be all of their records will be kept in one place. The records will be easily shared between providers as well as with the patient themselves. We'll be able to keep track of all of their medications from any provider that they see. This will be utilized between any doctor that they see over the course of their treatment for whatever reason. We'll be able to keep up with their medications, any interactions that are possible with new medications that are introduced. This is going to help with our billing with the insurance companies because they require so much information now to approve and reimburse for treatment. Things will be there'll be fewer errors that we will have to deal with as far as holding up our billing and holding up our reimbursements, so we will get our money back faster and the patient will get their money back faster. This will help eliminate conflicting diagnoses between providers. They will be able to communicate more effectively for the treatment of a patient with chronic or acute illnesses. We'll be able to communicate with the patients with information about their conditions and hopefully that they will be able to learn more about self-care when they're not with the physician or they're not talking with their doctor. Studies have shown that electronic records and personal health care records have made patients feel more comfortable. They feel like their quality of care is better. They feel like that they are getting more out of their time with the doctor and the time that they're not with their doctor because they're able to continue to communicate, ask questions, and anything that may come up when they're not in the office. So overall, I think patient satisfaction with these type of electronic records has been positive. Some other things we'll be able to do along the way with this is we'll be able to interact more with patients on social media platforms. We will be able to direct our patients to support groups for different types of illnesses. They can have online support where they may not have that at home. Also, patients that have caregivers, such as our Alzheimer's and dementia patients, they will be able to also get support online and also find out information and hopefully be able to answer any questions that they have that might come up throughout the course of caring for their loved one. Again, it comes back to efficiency and that our patients are getting the best care possible. And I think anytime that you introduce the latest technology, it helps to make this a lot easier on everyone. Also, what we will be implementing on social media will be the ability to speak with our patients about different behavioral modifications. That's things that they can look up online or on their social media site. They'll be able to interact with other people, as I said, that may be suffering from the same illnesses that they are, get support that way, ask questions. Doctors will be able to talk with other providers that may not be in the same country that they are in, but that may have a more familiarity with an illness or a disease that they're not used to dealing with. So they could get more information on possible treatments, possible research, other developments that are out there that could help them treat their patient much better. Another thing that we're going to be able to utilize is going to be e-health or mobile health. Those are things that we can use mobile devices for. We can set to send reminders. We can send appointment reminders to patients. We can send medication refill reminders to patients. We can set up all kinds of different things when they need to have tests run, whenever they need their annual screenings, such as mammograms, colonoscopies, different diagnostic tests like that. those are things that we can set up through the mobile health, to where we can send reminders. We will have reminders ourselves, but then we can send a reminder to the patient, which will keep everything moving again more smoothly, more efficiently, and get our patients the best care possible. Other things that we'll be able to use with the mobile health would be, again, the behavior modification, such as our smoking patients, our patients that are diabetic, that need diet restrictions, that need diet help, that need more information to help them care for themselves outside of our treatment room. Some of the setbacks, unfortunately, would be privacy. We do need to make sure that we are compliant with HIPAA on everything that we do. Anything that is posted, anything that is sent out to our patients needs to be secure and needs to make sure that their privacy is not breached. We need to continue to work along the lines of being able to communicate effectively with our patients, whether that be through language. If there are any language barriers, that we address that in the beginning and make sure that they understand what we are telling them. And also with our patients that have literacy issues, we need to make sure that they completely understand what their treatment and their diagnosis is and what our treatment plans are. A lot of this can be easily done electronically and through social media, through the mobile devices, the text messaging, the emails, all of those things I think will benefit us as well as our patients and help us be able to care for them more effectively, and again reduce errors in different things, and be able to get their referrals to other providers quicker and easier, and hopefully get their appointments faster than it would be when we were using the paper system. So hopefully everybody will be able to conform to the new system. Of course, it will be a learning curve with everybody, as it always is, but once it's up and running completely, I think that you will see that this will make things a whole lot easier, from the day the patient walks in the door to check in, calls for an appointment, to us having to send them out for diagnostic testing, to the hospital, to outpatient surgery, to the radiologist, wherever. We will be able to get their test results almost immediately after the testing is complete, because everything is being sent electronically and we don't have to wait for that paper. So if there is a referral for a surgery or whatever might come up with them, that can be taken care of a lot faster. So of course, over the time that we are transitioning, any questions that you may have regarding any part of this or any concerns that you may have, of course, feel free to let us know. Especially with our older patients who might not be as comfortable with technology as our younger patients are. If anytime that you're able to help them feel more comfortable with the way things are being handled, or that you can explain things to them as well as you can to make them more comfortable, the better off we're all going to be. So again, this will go into effect over the next few months. Everyone will have some training. If you have any questions, again, or concerns, you can always follow up with us anytime, any place, and we'll be glad to listen to your concerns or answer any questions that you may have. Thanks so much, and I hope everybody has a great afternoon.